Okay, here we go with class number 3 of our psychopathology course. And this week we're going to talk about the physiological impact of stress and different uh, contributing factors to stress. Um, I'd like to start this course by sort of going through an explanation of where we are at this stage. We talked last week about different ways of defining psychopathology and different diagnostic systems. We talked about the DSM 5 and we talked about sort of the difference between psychological conditions and psychological disorders. As you will see as we move forward, after this week, in fact, we start talking about specific disorders. So each week will be focused on a specific disorder. And what I wanted to do this week with the readings and the presentations, both here and at the live lecture, is talk about more specifically what stress is, because there's going to be this sort of confluence of how we talk about stress being a major factor in what causes psychological disorders, and then talking about the different psychopathologies that we will be um, working on throughout this course. And what I'm hoping to do a little bit more here is maybe bring in both the whole issue of uh, stress, not only as a physiological construct, but also as a psychological construct. One thing I haven't mentioned that much so far, and I did want to take note of this, is the course is actually called Psychopathology and Psychopathogenesis. We've talked about psychopathology, but I wanted to talk about this other term, psychopathogenesis, which, by the way, isn't formally defined in too many places. It's not a common term. But what it reflects for this course is we really wanted to look as much as possible on what some of the psychological factors are that contribute to the different disorders and the different psychological conditions that we'll talk about. Um, so, we're going to talk about stress as a physiological concept, but also try as much as possible to pull in, well, what are the non physiological factors that contribute to stress? What are the psychological factors that contribute to psychological conditions like depression and anxiety and impulsivity, and also contribute to the psychological disorders like major depressive disorder, generalized anxiety disorder, ADHD, bipolar disorder. So, sort of pulling in some of the psychological and environmental factors as well as the physiological factors that contribute to stress. So, this week in the lecture, both this one and the live lecture that we have later this week, I will be discussing um, stress as a physiological construct, but also adding discussion about the different psychological and environmental factors that contribute into this whole issue of stress. You know, when someone talks about being under stress, they oftentimes are describing themselves in a physiological state. Stress often feels a certain way. Uh, the person may be noticing that they're feeling warmer, or they may notice that they're feeling restless. They may be having, if it's a more intensive level of stress, they may be having heart palpitations, or they may be having difficulties focusing. Those are a number of physiological factors that contribute to stress. Uh, But stress may also mean that they are worried about something, that they are repetitively thinking about something, that they are um, intensely focused on something. Or it may be that they may be saying negative things about themselves or getting into a whole sort of loop of negative thoughts and putting themselves down and making negative statements about their potential for dealing with a problem. All of those are more I'm sorry, excuse me, all of those are more psychological factors that are associated with stress. So when we talk here about stress, we are combining both the physiological factors and the psychological factors that can include how the person acts, um, how they how they feel about themselves, what they are saying about themselves, and how they feel emotionally. Similar descriptions could be brought up about people saying things like, I feel angry. I feel angry often combines with it physiological feelings of feeling ups, feeling warmer or feeling very tense and feeling restless, feeling agitated. Those could be the physiological. And then anger um, also carries with it negative statements that the person is making about themselves, making to themselves about themselves or about other people. Uh, it can often involve being intensely focused on something that's bothering the person. I also wanted to use that sort of comment to make it clear of another important aspect about stress. Notice when I talk about the physiological makeup of anger and the physiological um, makeup of stress, they sound very similar. You know, there's a lot of similar factors in how the physiological aspects of anger and the physiological aspects of stress might be described. Feeling tense, feeling warm, feeling restless, possibly feeling agitated. And that brings up an issue that was brought up throughout the readings, which is um, uh, this whole concept of stress being non-specific. Non-specific is a term they use throughout the writings about stress that we had for this week. And what that means is stress as a physiological concept feels the same for feeling nervous, feeling angry, feeling agitated, even for feeling excited. The physiological aspect um, is the same. What often changes is the psychological aspect. One way I have described this to people is to say that if we had no words to describe, if we had no words for uh, feeling anxious and feeling excited, um, they both would be described the same way. The person's experience would be described the same way. And oftentimes, the thing that distinguishes um, negative emotional states from positive emotional states are how the person is defining the situation, the psychological definition that the person gives to the situation. If they are feeling restless and feeling like their blood pressure is building, maybe even feeling a little bit on edge, but something positive is about to happen. Say, or they are waiting on the birth of a baby, um, then it would then they would define it as excited, not because they feel different than they would if they were worried physiologically, but because their interpretation of the situation is a more positive one. I am excited. I am feeling positive about this new baby coming. Therefore, this physiological response I have must be a positive one. I am going to use a positive term to describe it, as opposed to if they were waiting on um, uh, waiting on a medical diagnosis for something bad, say cancer or something like that, because they are now waiting for um, a result that could be negative. They might describe it in more negative terms, and that's why they would describe it more as feeling anxious as opposed to feeling excited. Sometimes you'll see the crossover. Somebody will be worried about something and they will describe it as being something that's exciting them. But usually, excited is reserved for more positive situations, and worried is reserved for situations that, um, if they aren't already negative, have a strong potential for being negative. So, one of the reasons why the psychological aspects of psychopathology are so important is because it is often those psychological aspects, what the person is thinking, what they're experiencing, what is going on in their environment. It is often those psychological factors that determine whether the person is defining the situation in positive or negative terms, whether they are describing themselves as worried or describing themselves as excited. So, one thing we will see often going through this course is the degree to which the person's interpretation of what is happening and their interpretation of what they are dealing with plays a major role in how they describe their emotional state. So, stress, as it's addressed, and when I talk about stress, I am talking about the physiological uh, response that the person has uh, to a situation. Uh, but stress also carries with it um, psychological aspects that help define what that stress is. Um, so when we talk about psychopathogenesis, we are talking about the psychological factors that contribute to um, psychological conditions and psychological disorders. And I know we have talked throughout this course so far about cognitive behavior therapy. And that really is where cognitive behavior therapy really shines as far as a treatment approach, because the goal and the focus of cognitive behavior therapy is largely focused on how the person interprets a situation, what sort of behaviors and what sort of statements they make about what they are facing, which all reflects their interpretation of what they're dealing with. And cognitive therapy in particular focuses on what the person says to themselves about what they're facing, how they interpret what they are facing. So when it comes to psychopathogenesis, interpretation plays a major role in psychological disorders. How the person interprets what they're dealing with, how the person interprets a situation plays a considerable role in what sorts of outcomes the person faces in different situations. Okay, so I think we have a good sort of understanding here of uh, this concept of stress. It is both when we talk about stress primarily, um, we are when I talk about stress in this course, for the most part, I'm going to be talking about the physiological response. Um, but that is because the psychological um, factors are more contributing fact. Stress is defined as the physiological response, but the psychological factors often are what trigger the physiological response. And so that's why, even though generally when we talk about stress, we refer to the whole thing. When someone says, I'm under stress, they might be referring to their physiological response and what they're thinking and how they're feeling. But there really is, there really is a difference. The stress itself is the physiological response, and the psychological aspect are um, what what triggers that physiological response, and then also how we interpret that physiological response. So it gets a little confusing, but so like I said, for the most part, when I talk about stress, the main thing we're talking about is the physiological factors, but equally important to the physiological factors are the psychological uh, factors that trigger the physiological response, and the interpretations that come about because of the physiological response. And it is really those psychological factors, the triggers and the interpretations, that distinguish whether we are defining the stress response as anxiety, anger, excitement, impulsivity, uh, depression, mania. The the way the person responds to stressful situations, both in terms of what triggers the physiological reaction and how they interpret the physiological reaction, are really what distinguish the different psychological constructs like anxiety, depression, mania, impulsivity, perseveration, those sorts of things. So let me talk first here, and I know we went through. So I'm going to talk a lot this week about the physiological aspects of stress, in part as a way of uh, as a way of uh, having an understanding of what what that basic level of physiological reaction to stressful events, what that is. And then as we go through the different disorders, we will be looking at the different ways that that response is triggered, and also the ways that that response is interpreted. So let's start with just a general um, definition of what stress is. The way stress is typically defined is it is a non-specific response of the body to any demand placed on it to adapt, whether that demand is pleasure or pain. I'm going to say that again. It is a non-specific response of the body to any demand placed on it to adapt, whether that demand is pleasure or pain. Notice what we're saying there, that stress can be caused either because of positive situations or negative situations. Stress can be either one. Stress can be positive or stress can be negative. Um, People respond differently to stress. And it is often that difference that determines whether the person is um, suffering from a psychological disorder or whether they are functioning quote unquote normally. And it is that difference in terms of their response to stress that can determine um, whether the person has a depressive disorder, an anxiety disorder, bipolar disorder, schizophrenia. And different people to stress in different respond to stressful demands in different ways. And those differences can be because of the person's genetics, their uh, physical physiological makeup. That includes biochemistry. So it can be genetics. It can include biochemical makeup. It can include their history, the different ways that they've learned to deal with stressful demands throughout their life. It can be dietary factors that indicate how the person responds to stress. And notice that those differences can be long standing history. The person's history would be a long standing part, or could be situational. Um, People are often described as being more on edge and likely to respond um, to stressful demands in more agitated ways if they've eaten certain foods for breakfast or lunch, um, say foods that are higher in sugar. So somebody who maybe ate a couple donuts for breakfast might be more likely to respond in an agitated way to a stressful situation than might someone who ate eaten a more healthy breakfast, one that's more balanced and doesn't have as much sugar in it. Um, Certainly, the way we respond to stressful situations changes if we've used alcohol or drugs. Um, So those are situational factors. So the factors that can contribute how we respond to stressful situations can be more long standing. I don't want to say permanent because even those change, but they can be more habitual, shall we say, more long standing, or more temporary. And oftentimes, what we are working with in therapy to help individuals is to find different ways of dealing with those more long standing ways of dealing with stress. Uh, Now, it might be that there's even a combination of long standing and temporary. And what I mean by that is many people respond to stressful environments by drinking alcohol. So the use of alcohol causes a temporary change in how the person deals with a stressful situation. But the tendency to rely on alcohol to deal with a stressful situation may be more of a long standing problem. In fact, that's what many alcoholics will say leads them to seek out counseling or support groups because they realize that they have developed a long standing pattern of using alcohol to give them a temporary change in how they deal with stress. But they realize that that's not an effective way of dealing with stress. So they realize that their long standing pattern of relying on alcohol to deal with stressful situations, even though they recognize those situations are temporary, that long standing pattern is the problem. So, very often, the temporary change in how a person deals with stress might be a result of the person having a long standing pattern of relying on that approach. And like I said, counseling often is the process by which we try to help people change their long standing pattern of dealing with stressful situations in ways that are problematic. So we try to either change the triggers that are coming in to trigger the stressful response. That's where relaxation training, for example, comes from. Or we may try to address the interpretation that the person gives once they've started having the stressful response. That's where cognitive restructuring, which is a type of cognitive therapy, comes in. Cognitive structure restructuring plays up a major part of dialectical behavior therapy that we've talked about so far. So, stress is non-specific, is a response of the body to any demand that is placed on it for adapting to a situation. Situations change, so the individual needs to respond to that change, whether that demand is a positive or negative demand. And the trigger can be one that is entirely physiological, um, or it may be a demand, a trigger that comes about because of a psychological factor, something that causes one person to have a lot of feeling of stress may not be the same type of thing that causes another person to have a stressful response. Um, by the way, a positive stressful uh, situation, a situation that comes about that causes a stressful response for positive reasons, is called eustress. 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 Um, and that's more of a positive situation as opposed to distress, DISTRESS, which is a stressful response that comes about because of a negative factor, a negative experience. And is um, what is also interesting to keep in mind that too little stress can be as harmful in many situations to too much stress. And in a lot of ways, too little stress is what causes depression, and too much stress is what causes anxiety. Now, there's a little that's not absolutely clear because oftentimes the depression comes about because of the person's negative interpretation of having less stress. But just to give you a way to picture it, stress can be a contributing factor in both anxiety and depression. But in a lot of cases, it's almost that the anxiety comes about from there being too much stress, and the depression comes about when the person has nothing to be stressful about. Example for this is someone who is working at a job where 8 hours a day they're just constantly under demand. People are calling them saying, hey, we need this. Hey, we need you to um, take care of this task, take care of that task. That sort of situation causes anxiety. Depression often comes about In the opposite type of situation, where a person spends 8 hours, 10 hours, 12 hours with nobody asking them to do anything, you often get anxiety that a person develops when they're working, when they're in a high stress job, and then depression when the person leaves that job because they've gone from having demands almost constantly on them, um, meaning and purpose throughout the day based on people demanding things from them throughout the day. And then almost overnight, that shoots down and the person doesn't have um, any sort of demand on their time. So when the stress goes away, that often leads to depression. So in many ways, I said before that stress can cause different factors. And it's interesting to consider that it's not just the presence of stress or it's not just the concept of stress that contributes to psychological disorders. But another question that enters into it is it too much stress or too little stress? And too much stress in a person's life is what's more likely to cause them anxiety, and too little stress in their life is what might lead them to develop depression. Like I said, it's not that clear cut, and oftentimes what causes depressive disorder is almost getting distressed about not being distressed. In other words, the person recognizes that there's not much in their life for them to get concerned about, and having nothing to be concerned about causes them to feel concerned. But for on a very general level, it's interesting to keep in mind that too little stress is often what contributes to depression, and too much stress is often what contributes to anxiety. Um, what often Now, when we talk about this idea of how the person interprets the situation, it's not only that the person's interpretation might be that the situation itself is positive or negative, but it also might be the factor of whether the person interprets themselves as having the ability to deal with stress, a stressful situation, or not having the ability to deal with a stressful situation. So often the the construct of what is called subjective appraisal. Subjective appraisal comes into play because the person will be impacted by their interpretation of whether they have what it takes to deal with this situation or not, whether they are going to be capable of dealing with the situation or not. So the way the person appraises themselves and their ability to deal with a stressful situation can be a contributing factor to how much stress they develop. So the situation triggers stress, and often the situation triggers stress because of the way the person interprets the situation, but also the way the person interprets whether they have the ability to deal with the stressful situation. So the situation comes in, um, the situation may cause stress, and then what causes a negative response to go out may be one, whether the person ends up interpreting the situation as a positive or a negative one, and also whether the person interprets their ability as being sufficient for dealing the situation or not dealing with the situation. Notice too how a concept I brought up in a previous lecture enters into it, and that is the concept of homeostasis. Homeostasis is the body's attempt at maintaining a stable internal state. The body's attempt at maintaining a stable internal state. What is true of psychological and physiological aspects of the human person is that we want to have this feeling of homeostasis. We want to feel internally like everything is stable, and stress can cause that to be out of whack. And oftentimes, the psychological conditions that contribute to the psychological disorders we will talk about here comes about because there is a disruption in homeostasis. The person does not feel like they are in a stable internal state. We often talk about the fight or flight response, and that is a contributing factor to our body and mind's response to stress, to stressful events. Because what happens is a stressful event occurs, our body and our mind kicks into this fight or flight response, which is at our very base, because all animals have this fight or flight response, which is this thinking of, or is this response of either wanting to run away or attack. And the problem is, or the issue is, that once that fight or flight uh, instinct kicks in, once that fight or flight response kicks in, the body is no longer in homeostasis. It's basically a stressful situation occurs, and the human body and mind kicks into something's not stable here, something's not right, something needs to be addressed. And that's where stress comes from. Um, and the person responds to it physiologically, but also mentally as well. Talking about, and these are all in the readings, but I thought maybe I'd summarize some of the physiological parts to stress. There are two major components to the body's response to stress: the nervous system and the endocrine system, the endocrine system and the nervous system. Uh, what happens in the, and then the nervous system has two different parts to it. There is the central nervous system, that's the brain and the spinal cord, and the peripheral nervous system. Um, and so the peripheral nervous system, so you can kind of see it how the central nervous system is by definition the center part, the brain and the spinal cord, and then um, all the different nerves that stretch out from that central nervous system are called the peripheral um, nervous system. So what happens in uh, what happened some of the so there's this physiological response, and some of the physiological factors, some of the physiological mechanisms that kick in when there's stress is the hypothalamus. And the hypothalamus sort of gets the increased arousal going, increased heart rate, increased blood pressure, increased constriction of the blood vessels, breathing rate increases. Um, it's the body getting ready for some sort of fight or flight response. And then, um, so what tends to happen is the hypothalamus kicks in, and then the gets the body ready for this physiological response, and then the endocrine um, system kicks in, and that's what kicks out all these biochemicals out, um, and hormones and chemicals that also get different parts of the body. So you've got the hypothalamus kind of triggering this response response through the nervous system to all these different parts of the body, and then the endocrine system kicking out all these biochemicals that gets the body ready to go for the fight or flight response. Um, there, so and of course you've got all the other different physiological parts that are described throughout the chapter. Um, some different that I'll leave to you. Some different parts of the brain, in addition to the hypothalamus, that are involved in the stress response include the limbic system, and the limbic system is really considered the part of the brain where this interpretation of whether what the body is experiencing is coming because of fear, anger, anxiety, pain, excitement. So the limbic system is really that part of the brain where the interpretation is made about what is causing this stress and whether it's positive or negative. Um, the reticular, reticular formation part of the brain is the one that sort of makes the decision about what information coming in is processed and what sort of parts of the situation need to be paid attention to. So the reticular formation is the part of the brain where the person starts to make that decision about where to put their focus. And a lot of times anxiety can come about when the person is trying to deal with too much all at one time. ADHD is often described, for example, as a difficulty sort of arising in the reticular formation because the person tries to give attention to sort of everything. And then as that goes about, when you're trying to pay attention to everything, you really can't focus on anything in particular. So those are two other parts of the brain that come in. But keep in mind that when we talk about the limbic system and the reticular formation, and particularly the limbic system, we are putting focus in there because it really stresses the importance that the person's interpretation of the stressful events and then their learning experience for how to deal with the stressful events comes into play. So it's really issues in those areas of the brain that make up the psychological aspects of stress and how we interpret the situation. Because, and keep in mind, as far as the person interpreting um, the situation, it may be that even if it is a situation that others would consider to be quote unquote stressful, it may be that the person experiences and their interpretation is that it's not anything to worry about. It is benign. Or it may be that the person, or not benign as much as irrelevant. So it's benign or it's relevant, irrelevant, benign or irrelevant. Or the person may interpret the situation as being one that even though it's stressful, it's positive. Sometimes people not only define situations as positive because they're exciting, something good is happening, but they may define it as positive because they say, well, I like a challenge and here's a challenge. Or the person may see it in an anxiety as an anxiety provoking situation, or they may define it as stressful. They may also define it as a stress. So there are different ways that the person may define the situation. And they may also start to question themselves about, do I have the ability to cope with and handle this situation effectively? Okay, I think that's a good place to stop now for this, and then we'll pick up the discussion when we have the live lecture on Thursday. I will look forward to seeing you then, and please let me know if there are any questions that you have.